Good afternoon, good morning for some of you, and we're going to go ahead and get started with our next session. We are pleased to have health and safety at work during the COVID-19 pandemic as our next topic for today. Our presenters will provide workplace health and safety tips, review rehabilitation and employment services available for kidney patients, and share patient work experiences during the pandemic. Let's quickly take a look at the agenda for our session. Today's speakers include Lisa Hall, who is the Patient Services Director from CoMagin Health ESRD Network 16. She is joined with Michael Mace, a patient subject matter expert with the NPFE-LAN and the ESRD Network 16. And he's going to be sharing his experience as a kidney transplant recipient. As our presentation occurs, just as you have been doing, please feel free to submit your questions using either the chat or the Q&A, and then we will go ahead and answer those questions at the conclusion of the presentation. So let's go ahead and get to know our presenter, Lisa Hall, a little bit. Lisa has been with the Patient Services Director for ESRD Network 16 since 2010. Prior to that, she served as Patient Services Director for the ESRD Network 7. She has been published in peer-reviewed journals and textbooks and presents nationally on vocational rehabilitation, emergency preparedness, ethics, conflict resolution, social media, and psychosocial spiritual impact of kidney disease. Lisa has served as a leader advisor to CNSW, Executive Committee, the CASER Coalition, and Journal of Nephrology Social Work. Welcome, Lisa. And I can introduce Michael now, or would you like to introduce Michael in the presentation?
Why don't you go ahead and do the introduction for Michael, and I'm sure he'll say a few things as well.
Okay, so actually what I'll do, I apologize, we will go ahead and introduce, Michael's going to speak later on in the presentation, and I'll introduce Michael then, so I apologize for that. So at this time, I'd like to go ahead and turn things over to you, Lisa.
Okay, thank you. Can you still see my video?
Yes, we see you.
Okay, good, thank you. It disappeared for me. It's a new world. So next slide, please. I've witnessed firsthand through knowing dialysis patients, both when I worked in Florida and also here in the Pacific Northwest, how Voc Rehab can help people live a full life while they have kidney disease. Throughout this talk, I'm probably going to say Voc Rehab or VR because vocational rehabilitation is quite a mouthful. Next slide, please. So I think this is a great time now when the whole country is kind of on pause to focus your life on what are your goals. Do you want a job? Do you want a different job? A better one? Would there be a course or education or college degree that would help right now? Would being on home dialysis help you to have more flexibility to achieve your goals? Have you thought about kidney transplant? What are your dreams for transplant? I think this is a really good time for all of us to reflect and kind of see what we envision for our future and make small steps toward new goals. Next slide, please. Voc Rehab is not just about getting back to work for people who are already on Social Security disability. They also can help people who are currently working to keep your job despite barriers that might be in the workplace that are specific to you. People who work obviously earn more than disability pays. I think Social Security disability pays as much as 33% of your current income before you go on disability. And if you need help with accommodations at the workplace, VR can help to reduce or even eliminate any barriers to performing your usual job. Next slide, please. Research has shown that people who keep their jobs have better health outcomes, fewer hospital stays, a better quality of life, and are more likely to receive a kidney transplant. And we'll talk about that a little bit more in the next slides. So the next slide I want to talk about, you can go to the next one, I'm talking too fast. Thanks. So there is a case that set a legal precedent that people on dialysis have protections from the Americans with Disabilities Act, or ADA. And I wanted to tell you that, this is the only bit that I'm going to read. It's the case was Fiscus versus Walmart. Kathy Fiscus was employed by Walmart from 1986 until 2000. She was diagnosed with chronic kidney disease in 1995 and started in-center hemodialysis in 1998 and continued to work at Walmart. She changed to peritoneal dialysis in December of 1998, just a few months after starting dialysis. And initially, she was allowed to perform her PD exchanges on premises at work, which many dialysis patients do. She fell at work and was absent for just a short period after the fall, and when she returned, she was removed from her usual position at Walmart as a baker and a wrapper after she requested reasonable accommodation. She couldn't lift heavy objects after her fall, and she was offered a day shift position as a greeter. She asked to be able to do her PD exchanges on premises as she'd been doing before and was denied. And then she was told by her manager there were actually no available positions for her and to go on disability through her work. So she did. She got a kidney transplant in September of 1999 and had a period of recovery after that transplant while she was still on disability from Walmart. She tried to return to work, but I guess between the disability in Walmart and the transplant, it had been a year. And Walmart's policy said that after a year of disability, that you can't return to work. So she was fired in March of 2000 because she had not returned to work within that year, which was their policy. She sued Walmart and won because she'd had a physical impairment that limited her work, and she had not been given reasonable work accommodations, both for the lifting and also for doing her PD exchanges at work. And really had been kind of railroaded out of work onto disability because she had special needs. The Rehabilitation Act requires agencies to work with people who seek employment but have severe disabilities that are impediment to work and need VR services. So this was a really important case for both Social Security and vocational rehabilitation and Americans with Disabilities Act in kind of establishing that dialysis patients can work and have the right to reasonable accommodations. Next slide, please. We're going to switch gears for a moment and talk about going to workplace during the pandemic. Dialysis patients, as you heard from many speakers today and yesterday, are at higher risk of serious complications from COVID-19. And so you want to take necessary precautions, we all do, to take your temperature before you go to work if you're going to a workplace, wear a face mask, practice social distancing, wash your hands, and clean common service areas that other workers are using. Don't share objects with other workers. And most importantly, I think we all need to do in the community is not to gather with other folks at work. Next slide, please. So OSHA has guidance for workplaces during COVID-19, and I learned a lot when I was preparing for this talk to minimize workplace exposure. And they broke it down by risk level. In the next few slides, we'll show you that. Employers are required to assess occupational hazards, and you have the right to ask your employer about the level of risk for COVID-19 or other problems at your job. So I'm going to provide some examples from OSHA from their website on the next few slides. Next slide. So low exposure risk means minimal contact with the public or other coworkers. I have low exposure risk because I'm working from home. I'm a remote worker. office workers that go to the office but have very little contact with others are low exposure. People who are providing telemedicine, physicians or other healthcare workers, and long distance truck drivers, interestingly, are also listed as low exposure risk. The next slide, please. So a minimum exposure risk would be people who frequently have close contact with people who are not suspected of having COVID-19, people with frequent contact with international travelers, and then just contact with the general public, such as schools, factories, or retail settings. Next slide, please. High exposure risk is healthcare and support staff who enter patient rooms, and medical transport workers who are known or suspected or transporting known or suspected COVID-19 patients. And the next slide on this, which would be the very high exposure risk, are people who are performing specific lab procedures, such as aerosol generating procedures on known or suspected COVID-19 patients, and people who are handling lab specimens from known or suspected COVID-19 patients. We'll go to the next slide. So we're going to jump back into vocational rehab, and we'll talk a little bit about work accommodations during COVID-19 that some of our patients have benefited from toward the end. There are a lot of benefits, as I mentioned earlier, to pursuing personal goals for rehabilitation. I think these are benefits that a lot of us experience in our workplace, not just for kidney patients. And some of my favorites include independence, confidence, and a job well done, having a wider social circle, so people that you can, get advice from on, topics that they might have been through, or things that they might have been through, people that you can share with, borrow from, provide comfort to each other if you're stressed out. I mean, I think, I think we take for granted, a lot of us, think work is a 4-letter word, and I've even been guilty of that. But I think I would really miss my coworkers if I weren't in the workplace any longer. They've all been a tremendous sense of support for me over the years. And then a sense of purpose and identity comes from work. So those are some of my favorite benefits. The next slide, please. So how can you achieve work goals? I think the first thing to do if you're on dialysis is ask for support from your care staff. And I don't just mean the social worker, I mean the people that are providing your direct care, including your nephrologist. And you want to make sure that your dialysis treatment is work-friendly. Does the schedule fit with your goals? What about a home modality? Would that better suit your goals? Or nocturnal dialysis? Are there other barriers that you can think of? And I think it's a good conversation to have with your dialysis social worker, any barriers to your working, and maybe help with finding solutions together. The next slide, please. So some barriers and solutions, just a few are listed here, but there are some of the common ones. Some people say, I don't feel well, or I don't have enough energy. You can explore other treatment options, such as home dialysis or nocturnal. Patients report that they feel better, have better energy, less fatigue when they're doing home dialysis, or nocturnal, which is a longer duration and not as difficult on the body. Talk with your doctor about physical therapy. I think a lot of dialysis facilities forget about that. Patients talk about having low energy or not being able to do the things they used to be able to do. And I don't think physical therapy is ordered as much as it could be. Depression is certainly very common in dialysis patients, both at the early onset of dialysis, but also, some patients suffer from chronic depression. And, please talk with your social worker about how you can get support or referral to help to lift your moods and make you better able to focus on your goals. And I think the biggest barrier that people talk about are fear of losing benefits, particularly Medicare or Social Security income. And I'm going to talk in the next couple slides about Social Security work incentives that can help you to make an informed decision. There are Social Security work incentives coordinators that can actually meet one-on-one with you, most of them virtually nowadays, and sit down with pen and paper and talk about the benefits financially of working, what you might stand to lose or what you might stand to gain. And having that conversation does not mean that you have to move forward with making a decision at work, but at least then you're making an informed decision about whether that's the right thing for you. Next slide, please. So I'm going to talk about Social Security work incentives very briefly. There's something called the Red Book that has a much more expansive discussion of this. And I think we didn't get this slide changed, so I'm going to look at my notes. I made a last minute change. So Social Security has a trial work period that allows you to test your ability to work for 9 months. So let's say you're on dialysis and you want to go to work, you can earn as much income as you want and still get your Social Security check up to 9 full months of working. Then after that period, there's a cap on how much you can earn in addition to your Social Security. And if you go over that, then that means you're able to work full-time or have gainful employment, and the Social Security then ends. If you decide to go back to work, there's an expedited Social Security process to get your checks, not have to wait 5 months to get your Social Security checks if you're on Social Security disability. But you can continue to work after those 9 months as long as you're earning less than $1,310 per month. I have on this slide $1,260, and that was the 2020 rate, but it went up for 2021. So the amount of income that you can earn for 2021 is $1,310, and then if you're blind, it's $2,190. Certain items and services can also be deducted from that cap on earning. That commonly is things like adaptive devices that you need for work that you had to spend money on, or for learning your job, or work-related transportation. Both the dialysis social workers and your ESRD networks are well versed in this information, and it's a lot of information to share in one brief presentation, and are happy to assist you in talking about these things. So the next slide. So I want to talk about work incentives and transplant, and I know we're having some wonderful changes coming in the coming years to how Medicare pays for transplant medications. But as it stands now, when you think about your goals and your dreams and what your life might look like after transplant, if you're considering getting a transplant or you're already waitlisted, I think it's important to think about doing something different after transplant, because it frees up all that time that you've been spending on dialysis. And there are work incentives in place to help you to keep your Social Security benefits, including cash benefits and Medicare, for as long as 7 years and 3 months after transplant. It's called continued payment under VOC Rehab or a similar program. Normally, Social Security checks end 1 year after transplant, and Medicare ends 3 years after. But if someone is active with and continuing to work with their vocational rehabilitation counselor in education that's provided through the vocational rehab program, including college, which Michael will talk about later, you can extend those benefits well beyond the usual time frame after transplant. Next slide, please. So to learn more, you can search for a vocational rehabilitation or an employment network. An employment network is a common employment network that a lot of people probably have heard of is Goodwill. So it's another place where people are qualified by the government to provide employment services to patients under the vocational rehabilitation program. And you can search for one by zip code. It's very easy, and I provided the website on this slide. Or you can call a toll-free phone number, and they can help you. Or you can talk to your dialysis social worker, and they usually know their local programs or can help you with the guided search. And after you've engaged the vocational rehabilitation program, just like any other entity, some of these programs don't always necessarily know the regulations or don't know the rights of dialysis patients in terms of being disabled, and they might give you misinformation. So it's really important to talk to your dialysis social worker about how the process is going and ask for any help with barriers. Next slide, please. I do want to mention there's also a client advocacy program for each state that can assist with barriers and make this process go smoother if you get misinformation when you go to the voc rehab office or have a virtual appointment. So during this social distancing era, it's a great time to connect with virtual programs that can assist you with supporting employment. I just listed 4 of them here that are my favorites. One is Career One Stop, and they help with career training, resume building, job search. AAA Take Charge actually pays work-related expenses to help you stay employed or work toward a career goal. My Employment Options specializes in work-at-home jobs, which I used to promote a lot with people who are rural when there weren't a lot of jobs near their homes, but I think it's a great time to promote that as well during COVID-19. And then there's a National Telecommuting Institute, that's an employment network that helps with work-at-home jobs as well. And the links to those resources are on this slide. Next slide, please. So to summarize what voc rehab can do, they can evaluate your strengths, your goals, and your career interests. They can help with education or training to get a good job. They even can help with a business plan if you're thinking of working for yourself. They can help with special equipment needs and help you to keep your job if you already have one or you get one. For living in really unusual times that require unusual measures, we all hope for a vaccine and more effective treatment for COVID-19 will come very soon. I know the vaccine has come. It certainly hasn't come in my household, although my husband keeps trying. He's a 68-year-old essential worker, and I hear similar stories. So we're very hopeful that when he gets that vaccine, we're going to have a little bit more freedom in life and feel a little more safe. Yeah, one day we're all going to be able to return to life as we know it. But for now, I think it's a great time to reflect and think about your goals and maybe plan for the future. Next slide, please. So I wanted to talk just very briefly about some success stories from patients that I've known here in the Pacific Northwest. Many of you know Nancy. Nancy started dialysis in 1966, back when Medicare did not pay for dialysis. So when she became an adult, she had to get a job with insurance. So a voc rehab counselor helped her to get a degree in education, where she became a teacher. And then later she decided to become a nurse and went through voc rehab again. And she worked as a rehab nurse for over 40 years with end-stage renal disease before retiring a few years ago. Next slide, please. Gary, who has presented with me on national calls before, lives in Alaska, and voc rehab helped him to go to college and advance his career and continue to provide for his family. His workplace helped him with accommodation during this pandemic. He actually was allowed to go into work only on the weekends when no other workers are there and do his work, so that he would be isolated in the building alone, and then he was able to work from home, because being a peritoneal dialysis patient, it was important for him to stay safe and stay isolated from risk of infection. Gary is a living example of how work and dialysis can go hand in hand, and I think he's an inspiration to all of us here at ESRD Network 16. And the next slide is about Michael, and then this will be the last slide that I present on. Michael is one of my colleagues, a dialysis social worker, and he's with us today to share his story. Michael is a true inspiration both to patients, he's on our medical review board at ESRD Network 16, and he inspires the staff in his dialysis facility and in the general kidney community. So I'll hand it over to Michael. Thank you.
Thank you so much, Lisa. And before we hand it over to Michael, if you don't mind, I'd just like to quickly introduce you without giving away too much about you. Just to give a quick bio, Michael Mace was diagnosed with end-stage renal disease, ESRD, in September 1997, and he has had his donated kidney for more than 20 years. Michael formerly was a restaurant manager for Wendy's and was encouraged by 2 dialysis facility social workers to continue his education. And he received a Bachelor of Arts in Social Work from the University of Washington-Tacoma and his Master's in Social Work degree from the University of Washington, Seattle. He is a subject matter expert with Comagin Network 16, a legacy subject matter expert with the NPFE-LAN, and he also volunteers for the Pierce County Juvenile Court and works with families to reduce domestic violence in the home through effective communication. So welcome to the call, Michael.
Thank you for having me. Am I on?
You are on. We can hear you.
Can you see me?
We do not see your video yet.
Let's see here. How can I do this? Start video. Well, there we are. How's that?
And we see you. All right.
Okay. Well, thank you for having me. It's a pleasure and an honor. And you know, Lisa has been so intricate in helping me get along with what I got to do. I also have to give you know, Nancy Spieth and Gary are amazing people, and working with them has been nothing but a pleasure. Again, with my story, I was a diabetic for 23 years. I had not taken care of myself the last probably 10 years of being a diabetic, and I ended up on dialysis at the age of 35 in 1997. I then I was on dialysis, and I was a restaurant manager for Wendy's at the time, and I was trying to do dialysis and work at Wendy's. I worked at Wendy's from 5 p.m. till 3 in the morning, and then had to have dialysis from 6 to 10 a.m. So there wasn't much rest in between. It eventually caught up with me, and I had to let that job go. But with that, it was a blessing in disguise. So in that, I was gave up the work, but then I participated in the working with the patients at the dialysis center. So what I did with that was I participated in a support group that we led bi-weekly at St. Joseph Hospital. Now, the social workers, 2 of them, came to me and they said, "Michael, you would make a great social worker." And I asked them, well, you know, I can't do restaurant work anymore. And I happened to, there's like no way. And so what do I got to do? And she goes, well, you're going to have to go back to college. And I said, well, how do I get started with that? And she directed me to Voc Rehab. And so I went to the Voc Rehab. And again, I had been on dialysis. I started dialysis Christmas Eve in 1997. By March of 1998, I had finished the workup, and I was listed active for transplant in April of 1998. Now, when I went to Voc Rehab, my first initial interview was in May, and I told them, I said, you know, I'm listed active for kidney transplant. And they said to me, well, you better go get your transplant and then come back and see us. But in the meantime, I had gotten registered with them. I had completed all the documentation that was required, and I was, you know, I was kind of put on the back burner. So I got my transplant in July of 1998, and so I was doing well. I was in and out of the hospital in a week. I was recovering well. And so I went back to the voc rehab in late August of 1998. And they said, yeah, we can work with you. So I started the ball rolling. Well, then in the end of September, October, I had a rejection of my kidney and ended up in the hospital for 30 days. They changed my medicine from Prograf to cyclosporin, and everything worked out. And here we are 22 years later, I still have the same kidney. So it has been quite a blessing for me. But with the voc rehab, when I went back to them, they said, you know, you're going to have to do the work. I said, I'm more than happy to do the work. What do I got to do? And they said, here's what we're going to do. And they set me down in front of a counselor's, two of them actually, and we kind of game planned how I can become a social worker. And they put me in front of the right counselors at the right college. I went to Tacoma Community College for my associates, and they had me talking to counselors and how I can get financial aid. They assisted with my first and second quarter books, along with my social worker at St. Joe's Medical Center and Bill Bowden up at Northwest Kidney Centers, who I was working with and with conferences and that, and he assisted me with getting funding for books, and got the loans going. And long story short, 7 years later, I was working side by side with the social worker that told me to become a social worker. And so it was truly amazing. And so voc rehab had really given me a new opportunity, again, a new direction of where I was going in life, and given me the opportunity to serve the renal community, giving back what I got, and being able to serve the community at large in other aspects, like with the juvenile court. So, and again, I'm still a dialysis social worker now of 16 years, and you know, it's just been a wonderful journey. You know, again, with the journey that I've gone, voc rehab, again, I'm able to now refer patients to voc rehab. I currently had a patient get a kidney transplant, and he's working with me at voc rehab, and now he's becoming a counselor. So it was really, really amazing and heartwarming to see my patients go forward with voc rehab and get placed in either education or get placed in a job, or both, so in some cases. So that is kind of where my story went. I was, again, so appreciative. And again, with the COVID vaccine shot, I've had actually both of them. And as the doctor had spoken earlier, you know, I had mild symptoms with the first one, the shot in the arm. And again, my arm hurt. I got the shots on Saturday, so I knew I'd be off work on Sunday. But my arm was sore for a day or two. The first one, not much symptoms or effects. I was still able to change the spark plug wires in my car. The second one was the Saturday before the Super Bowl, so I just took it easy on Super Bowl Sunday and watched the game. But again, the effects with the shots happening affect people differently. I had some coworkers that were down for 2 days after the second shot, but they were really glad they got it. Again, I'm immunosuppressed, I'm a transplant patient, and I'm frontline worker. So, I mean, even the shots help, but I mean, we still have to gown up, with the face mask, the shields, the face shields, the full PPE gown, as many patients see in the dialysis center, with the gloves. Every time we see a patient, we have to change gloves and re-sanitize and go to another patient. So it's, again, the PPE, the protective equipment, and along with safety protocols that are in place, either with the dialysis facility that we're working with, to ensure that our patients stay safe. So I would recommend the vaccine. But again, I appreciate this opportunity to let you all know that Voc Rehab does work. It made a huge impact on me, made a huge impact on the renal community and all the lives I've touched through the years. Again, I've had my transplant for over 22 years, and I'm still going strong. My labs are just like day one. You know, going through Voc Rehab, and again, when I talk to patients, I talk to them and I say to them, let's start at the beginning with the end in mind. Start at the beginning with the end in mind. And as Lisa had pointed out, you know, what are your goals? What are your aspirations? What do you want to move forward to become or do going forward in your life journey?
Thank you so much for that, Michael. I like your synopsis of starting with the end goal. Start with your end goal in mind. So thank you for sharing that. I think that's a great way to look at this whole topic. At this time, I'd like to remind everyone that we do have an opportunity to share some questions with both Lisa and Michael. So we do have time left in this session. So please submit any questions that you might have for Lisa or Michael. They both presented some great information. Lisa, some phenomenal information about VR and the benefits for you, and Michael from his experience. We do have a few that came in. So Lisa, this one looks like it is for you. Lisa, if a patient wants VR services, who at their dialysis facility or at their network should they contact?
Thank you for your question. Start with a dialysis social worker, and keep in mind that some dialysis social workers, especially if they're new to dialysis, might not be as well versed in vocational rehabilitation as we hope. But there probably is a lead social worker who can assist them, and the ESRD network is actually tasked with providing technical assistance to dialysis social workers or directly to patients to help them kind of navigate the vocational rehabilitation process. So either the dialysis social worker or the ESRD network will be happy to assist.
Thank you for that, Lisa. And Michael, this one is for you. How did you know you were ready to go back to work?
Well, how I knew I was ready was because, you know, I had been a restaurant manager. I've been in the restaurant business for 20 years. I was a restaurant manager for 8. I managed Denny's, Old Country Buffet, IHOP, and at the time I was managing Wendy's. And my income at that time was about $40,000 a year. And then all of a sudden, next thing I know, I have an income from Social Security of only $1,100 a month, and I just couldn't live on it. I couldn't pay my car insurance. I couldn't pay to drive. I had to catch the bus for 5 years. I was like, there's no way I can live like this and stay healthy. I knew for me, being on in-center hemodialysis, and again, this is 20 years ago, I wouldn't have survived 5 years of being on dialysis. So I had to have the transplant, and I knew that I could be a good social worker. I knew how to touch tables. I knew how to touch people. And I knew my transferable skills would work with being in social work. And so when I went to school, because I got the loans, I was able to actually live and become like a professional student and live on my Social Security and my loans. Again, as Lisa had mentioned, 3 years after my transplant, I was reevaluated for Medicare, and back then also Social Security. And they said to me, you know, let's take a look. You got to go before a doctor. They're going to evaluate me. Well, they did evaluate me, and because I was still blind in my left eye, and I had neuropathy, severe neuropathy in my hands and feet, and there were other circumstances, they said, you're still disabled. We're going to keep you. VR advocated for me, saying, you know, that I am still disabled, and I was able to continue with my education and continue getting my master's degree with you know those determinations, and that allowed me to finish my schooling and become a social worker. In fact, I was taken up as a social worker for DaVita at the time. Prior to even finishing my master's, they just like they said, no, we need you. You've got the experience. You have the knowledge. So it worked out really well. Now, again, as Lisa had mentioned, 9 months after, Social Security came back to me and said, look, you're working full time. You know, we're going to cut you off Social Security, and they did. And I just kept working full time and was able to live a comfortable life, not extravagant, but comfortable. And I was so appreciative of all of that. Yes.
So, Kim, I see a question in the chat that I'd like to bring up. Whether it's common for voc rehab. Oh, okay. Whether it's common for voc rehab to make you wait until after transplant, because some people would have a long wait. Oh, this is why we have social workers, both in dialysis and the ESRD networks. There's no reason to wait till after transplant. I think there are voc rehab counselors in certain places at times who think that dialysis patients are capable of working, and we've all seen that many are, with or without voc rehab, and others might have different circumstances, but it should be evaluated on an individual basis, and there's no reason to not at least be working toward your work goals with voc rehab before transplant. And the eligibility for voc rehab actually extends beyond 1 year of transplant. So the window for being in voc rehab is actually within 1 year after post-transplant, or there's no longer eligibility. So prior is better.
Mm-hmm. Absolutely.
And there's another question that ties into that. The question is, Lisa, you mentioned that enrolling in VR can decrease your time on the transplant wait list. Can you speak more to that?
No, and I probably should have cited or looked for those studies. There have just been studies that have measured different areas of quality of life that are improved by vocational rehabilitation, and it's through the United States Renal Data System data, and I think the last USRDS voc rehab specific study has been over 10 years ago, but in looking at that data on dialysis patients, it was determined that there was more likelihood for transplant for folks who went to who were active in voc rehab or actively working, which makes sense. It probably means that they're goal oriented, they seem motivated, they probably do go through the whole voc rehab process, they're more likely to have health insurance, etc.
Okay. Thank you for that clarification. Here's another question for you, Lisa. Does a VR specialist connect people to scholarships and/or grants?
Yes. In fact, they look at those first. They'll look at Pell grants or other local grants first, because there's not unlimited funds with a voc rehab program. And of course, Michael's experience was 20 years ago. So Gary, who couldn't be here today, had a more recent experience with folk rehab and did benefit from grants that paid for a computer, for his books, for his tuition, etc.
Very good. Okay. And Michael, did you want to add something to that, Michael?
Well, yeah. I mean, again, the Pell Grants are wonderful. They also helped me because they were able to put me in front of the school counselors who were able to find me subsidized loans, and so I didn't have to pay the full ride, and it really saved me a lot of money. Being on the subsidized loans, and I did get 2 Pell Grants.
Good. Thank you for sharing that. This one, Michael, the question is, given the current environment, so COVID-19, would you still have gone back to school? So if you were doing it now, would you go back to school with the current environment?
Absolutely. Yeah, and I know that there's going to be more barriers because everything is pretty much virtual. But again, in the end, you're keeping the end goal in mind at the beginning, and the end goal was for me to work and be productive, and it gave me a sense of purpose, a sense of being, a sense of, hey, there's a goal here that I need to reach. I mean, when I was on dialysis, the only thing I could think of for me was that I needed to live long enough to see my 2 sons graduate high school. And, you know, after the transplant and keeping working, keeping active, exercising 3 times a week, again, this is why I've been able to keep my transplant. But in essence, I was able not only to see my 2 sons graduate high school, but my oldest son is a dialysis technician, and I've been able to work side by side with him for, you know, in the same business, the same company, even sometimes in the same facility for 15 years. And that in itself has been a blessing.
Very good. Thank you for sharing that. Lisa, this one is for you. The question is, I am in the VR program, and I want to go to schools for. I want to go to school for to be a medical assistant. I am on dialysis. Is this something that I should pursue from your perspective?
Well, that's something that probably should be discussed with your voc rehab counselor and also with your dialysis social worker and nephrologist. If you're already in voc rehab, if you're looking at dialysis organizations too, I think there's some assistance with that as well, with becoming a medical, you know, I don't know if they're looking at becoming a dialysis technician, but I think it's an achievable goal.
Just stated medical assistant, so.
Yeah.
But good advice to talk to those that you are currently working with.
So a better answer to that really is that the voc rehab program will work with you on anything that you seem motivated to do and that seems like a realistic goal. So if you kind of go in just like going to a job interview and say, oh, I don't know if I want this or not, or I don't know what I want to do, but I know that I should do something, you're less likely to be working toward a very clear goal in your mind, like a medical assistant or whatever you have, if you don't have in your mind kind of an end goal, like Michael mentioned, or a plan that's pretty clear in your head and you're ready to kind of roll up your sleeves with your counselor and work toward it.
Very good. We did get another question. Should I tell the company I'm interviewing with about kidney disease? Or about my kidney disease?
There's no requirement to, and I'm sorry I don't have the information in front of me. My policy guru friend Beth Whitten is better at this than I am. Michael, have you fielded that question?
What was the question again?
Is it required, or should you tell your employer that you have kidney disease?
Well, my employer knew.
Too.
My doctor referred me to, so everybody knew that I was a kidney dialysis patient. You know, the thing about that is that if you're upfront with it, then what happens is they can make those accommodations up front. Because if they see that you have the skills and they want to fill that position with the best person, and you are that best person, you know, again, in the interview, when you're interviewing with those folks, you can tell them, you know, that you do have kidney disease. I was upfront with mine, letting them know, hey, this is where I'm at, this is what I can do. They were way more willing to work with me when I'm upfront about it, instead of later on down the road, 3, 4 months, a year, and then you're saying, oh, I have kidney disease, I'm not feeling well, and you know, they're like, well, what, how come, what's going on, and why wasn't this divulged in the beginning? So I don't know. I personally, being upfront and being forward with them and assertive that you have the abilities to do the particular job that they're asking you to do, I would think that would be a better route, honestly. But that's me. That's my opinion.
Okay. Well, thank you very much for sharing that. And at this time, I'd like to thank you both for sharing your experiences and your expertise. And I'd like to thank everyone on the call who submitted questions and joined in the discussion. Your questions, not only does it give us an opportunity to obviously answer your questions and increase your knowledge, but it gives us the opportunity to look at where you are seeking additional information, and that helps the NCC and CMS. Now, before we can, go ahead, Michael.
I just had one last thing. You know, it's a lot of work to be healthy. It's a lot of work, and it's a lot of work to seek your goals. But it's also a lot of work to be sick, and it's a lot of work to making those doctor's appointments and feeling bad in this. So again, which lot of work do you want to choose? Do you want to choose a lot of work where you're healthy, or a lot of work where you're not so healthy? The choice is each individual, and each individual's situation is different. And so there's no judgment. It's just, where are you at in your life journey, and how do you move forward?
Very well said. Thank you for sharing that.